Welcome. This is our Afterthoughts segment where we keep our guests around from our broadcast show for a little more kind of exclusive and in-depth discussion about some of the issues. Today with us we have Dennis King, CEO of Maine Health Partners, and Dawn Stiles, President of Spurwink Services. Thank you for sticking around. We had a good, quick segment on the show. And I wanted to have you around to talk more about, first of all, I was so impressed by kind of I think the viewers are going to be too, by, because I mentioned, we're largely business owners that are watching this thing. Well, you're business runners too. You're CEOs that are really running these things, exactly. And having to use kind of the best practices, entrepreneurial practices to make it work. So we're going to talk more about that. But I also want to talk about kind of the cuts that are happening, because that's clear. Other businesses, if I'm just a private business out selling widgets, making widgets and selling them, I have a lot of opportunities. Okay, I can look for new markets, I can do things, and I have ways to diversify my revenue stream. You're trying to do that, but still, you're primarily. It's government funded through Medicaid and Medicare. Those are going to be huge cuts. Talk about the cuts.
The cuts are very deep and very severe. And it's not only that they're taking place now, but they've been taking place in certain segments of mental health for some time, several years actually. I think that what's important for business people to understand is that it isn't that people who have mental health issues go away or disappear. There is a social cost involved in it. I can tell you personally, since we're involved in 3 emergency departments, that the longer length of stay in the emergency department are very expensive, causes delays for other patients, and so it doesn't go away, and we're always going to be dealing with it. The scale of these cost cuts are really budget cuts are really very significant. In our system. It approaches $3 million just in mental health. And so you have to contend with that. All
right, well, let me ask this hard question then. There are going to be some, with any downturn, economic downturn, this is an economic downturn that relates for you all as well, the weaker businesses are going to go out of business. Are we going to have smaller mental health providers, are they going out of business?
Yeah. We've seen some go out of business already, and looks like it will continue for another few years.
In economic terms, sometimes that's not necessarily always a bad thing, though.
Yeah,
is that the same? You know what I'm saying?
Well, in this case, Maine is characterized by having a lot of very small providers, who don't do great work, but they don't have the capacity to withstand an extended period of retrenchment. And so I think that's probably we're going to find that happening.
Absolutely, and
so there are some advantages. I mean, some possible advantages that we can. In terms of merging and reconstructing that system, even though there's some harsh cuts? Okay. I'm sorry, I interrupted. Go ahead.
I think the important thing to keep in mind, though, both of us are in doing what we're doing, working for a locally owned, if you will, board of trustees, nonprofit board of trustees. And so it's easy for us to sit here and talk about services changing and morphing and disappearing, but it's really got to be done, when it's done, in a way that's very sensitive to the needs of the local community. So you can't centralize things in an area like Portland or Bangor and expect that to be the answer.
It's not like closing a Hannaford and saying, you know what, we're just going to close that one. You're just going to have to drive 30, 40 more miles, which Hannaford could do if they want to. And that's just a business, bottom line business decision. You have a different set of criteria. It's people.
This tremendous alliance to those small agencies that have started up because of a need. And so you have donors and you have clients and you have board members who are so invested in the name and the service, and it's very hard for them to let go.
Yes. Does that get in the way of making a wise business decision sometimes at the local level?
Well, it's funny. I would say in my experience the answer is no. I mean, you have to understand that what is a solution is, again, a solution in Bangor or Portland is not a Bridgeton solution. So you have to be creative and work with people around that.
Okay. Another question I wanted to ask was the whole movement. I mean, when you look at community health care kind of as a system, and it seems like that's the right model to go for. Obviously, we're going through lots of reforms in health care right now, and we're going to be talking more about that on this show in the next several weeks. But looking at that kind of community-based health care, where you're looking at the whole community and trying to figure out how do we do this more effectively, efficiently, well, mental health is a part of that. And it should be a part of that, just like your emergency room, your primary care, your physicians, all of those things. But when they're lumped together, if you put them together, isn't it a drain on the rest of the systems in terms of funding? This is not a moneymaker.
No, it isn't.
Whereas surgeries can be, whereas some things can drive the system. See where I'm going with that?
But it doesn't have to be a money loser either.
Okay, talk to me about that.
I think the thing that we've realized is that given the right scale, given the right responsiveness to what our customers want from us, including the state, that we can be viable. We're never going to thrive, but at least we can survive and perhaps do a little bit better.
And I think that over the past, and we've had budget cuts for 8 years.
Right.
And
this is not new, right?
This isn't new, but what it's created are a lot of efficiencies. When I came to Spurwink 10 years ago, there were a lot of programs that were losing money. And it was seen as we're going to continue to do that because there's money in the system, it's a community benefit, and people just accepted that they lost money. Well, we don't accept it anymore. Our standard is that our programs all have to at least break even. And so you look for other efficiencies, and it really forces you to renegotiate leases, buy in bulk, look at what you give for benefits, look at who you can partner with, how you can reduce your overhead. And so it really forces you to be efficient. Now, we're at a point where there aren't a lot more efficiencies to find.
So far, right.
Absolutely. But so there are benefits to having that kind of scrutiny. But again, it's got to be to a point where it's still sustainable.
And I think we both agree that as we now move towards an environment where we pay for evidence-based care as opposed to 10 or 15, 20 years ago, where you're
what does
paying
evidence-based care mean in this world?
Evidence-based care means you're paying for what works.
And why don't we do that everywhere?
Well, see,
Sorry,
that's
did
true.
that slip out? Did I
No,
say
that's
that
true.
loud?
But I mean, mental health's been a little slow to the party.
Yeah.
Because it's a relatively young field, actually,
Yeah.
in terms of healthcare. So we're moving. The good news is we're moving towards that. We can demonstrate what's successful and what works for patients.
So would you? Okay, I'm glad you brought that up because. From a business point of view, so you're actually looking at evidence-based, what works. Is it talk therapy versus a mix of medications, or those kinds of things, and seeing where does that evidence come from? How do you construct that to determine what will work and then which path you should go?
There are a couple of different ways. There are big institutions across the country that are doing research and publishing. So they have longitudinal studies that they've shown over several years that this method of treatment has good outcomes. And then there are promising practices which, the evidence isn't quite as long-term so that they can't say definitively that this works. And then there are local efforts where people are just starting. And we have a research department and we collect and publish our outcomes.
Excellent.
And so we're adding to the body of literature in the public. So it's really making a commitment that your organization cares about whether or not what they're doing is successful, and then finding some measures that can predict it, and then being true to that and collecting that data and examining it, both so that you can give it to funders and say, this is where we spent your money and this is the outcome, and also to enhance your own practice, because we don't want to be doing work that isn't achieving some kind of success.
Go ahead, I'm sorry.
Well, I was going to say that we also, we have a similar interest and experience in research, and just substantiating the success of a certain type of modality, such as in-home assertive community treatment programs, being able to get grant money to provide evidence that works can help us with the funding aspect of it when we approach the state, because if they're state-funded programs. There's a practical side to it.
I'm running along here, but I got to ask this question too. One final question I think about. You've been doing rationing forever, haven't you? People, healthcare providers ration. Is that going to change? As we move through this kind of healthcare debate, how do you see that impacting mental health service delivery?
It's interesting, the rationing argument. We don't have a choice on the people that we see.
Yeah.
It is truly, when they come in the emergency room, you can't say, well, you can't have that tonight.
Right.
So that's what happens when you run into an underfunded system that's publicly funded.
Right.
Homeless, other types of people have no funding, end up on the short end of the stick. So we don't have that option. What we do, or at least what we do. You have the same sort of.
We're limited by our resources,
Right.
But they end up somewhere.
They
do.
Whether it is in jail.
It moves it to
jails.
Absolutely.
That's the thing. That's what I meant.
Absolutely.
As I really liked what you said earlier, which was the cuts are going through, and everybody understands that. But do they understand that the numbers of the need to service haven't changed?
Yeah, it doesn't go.
In fact,
Doesn't
maybe
go
going
away.
up, for that matter, so that doesn't go away.
Absolutely doesn't go away.
It's very interesting. Thank you very much for this.
Great.
This was a
Thank
great
you.
opportunity for us to talk about this from a business point of view and let folks know what's going on out there. Thanks. Great opportunity.
Thank you for the
Appreciate
opportunity.
it. Thanks. Thank you all.